The decision to go ahead with a wrist arthroscopy, what that involves is an arthroscopic procedure like a knee or shoulder arthroscopy, which are more commonly performed. It involves very minimal incisions on the back of your wrist, sometimes on the front of your wrist. They're only a few millimeters in width. Instruments smaller than this pen are inserted into your wrist. One's a camera and the other could be a probe or another instrument to help clean up any scar tissue that might be involved. It's a procedure that's used for a variety of things, anywhere from fixing torn cartilage, debriding torn cartilage, fracture fixation, even some more complex things, ligament repairs, reconstructions, as well as bony fusions. The indications are starting to expand and the technology is starting to expand as we are getting more proficient with the skill, but it is something that's done mostly by a hand upper extremity surgeon. And depending on their skill level, that will determine what procedures can be done arthroscopically, and along with their comfort level, and also the practicality. Some things you could do through an arthroscope, but maybe necessarily shouldn't be done through an arthroscope. When you're going in for surgery, it's the same prep as any outpatient surgery. You'll go in the morning, you'll get prepped. Likely you'll have your arm blocked to make it numb before, during, and after surgery. You'll have the surgical procedure and then you'll go home later that day. And the good thing about arthroscopy is it's very minimally invasive, so the soft tissues aren't as damaged as a large incision might be on the back or front of your wrist. So that's one of the good points about arthroscopy.